Know your risk. So age, are you over 50? Even 30 to 50, remember 30 to 50 you're more likely to get the inflammation, but over 50 you already now qualify to have a PSA test at your doctor's. So bear that in mind, because many GPs are not aware of the fact that this is something that you're entitled to. So you may have to be quite insistent. Do you have a family history? So father, brother, uncle who has had or has prostate cancer. You are 2.5 times more likely you're in a high-risk group. And are you black? Well, the answer is yes for all of you here, which means that you are twice as likely to get prostate cancer as your white counterpart. So many of you fall into at least 2 of those categories. Well, all of you at least 1, and some of you at least 2. So it's something to think about when you're being proactive about your health. Do you remember we said that you may not have any symptoms? So if you don't have any symptoms, but you fall into a high-risk group, maybe you should just go to your doctor anyway to ask for a PSA test, which is your right. When I lived in Canada, it seemed that we had a more proactive approach to health. So we had, you'd go and have a physical, you had a gynecologist, or you had a pediatrician. You went and saw those people on a schedule, maybe yearly or 2 yearly, and it was almost preventative in a way, or at least things would come up pretty quickly if something did happen to you. Over here, I think we tend to, we can't get the time off work, we don't want to disrupt the family schedule, I'm too busy to look after our health. Now, when I first, I was in the aviation industry. When I first went into the aviation industry, I was working as a flight attendant. And this was many, many moons ago. But most of you, I'm sure, will have been on a plane. And they tell you during the demonstration, not just the exits are this way. See how professionally I do it? I was trained. Still got it. They tell you if there's a decompression, if the cabin loses pressure, you put your own mask on first. And I tell you this because at roughly 33,000 feet, you have what we call about 15 to 20 seconds. It's called the TUC, the time of useful consciousness. It doesn't mean that you're dead. It just means you will pass out after about 20 seconds, at that altitude because there's no oxygen. So if you don't put your own mask on first, you can't help anyone else. If you don't look after your own health, you can't help anyone else. You can't be the backbone for your family. You can't raise your children. You can't build a strong community. You can't spread the good news. So you have to look after your own health. And having this type of information is not meant to scare, it's just meant to inform so that you can then say, oh, okay, I fall into this category, I fall into this category, I need to go and get myself checked out.